Our basic science curriculum is really very much clinically oriented. Students are able to learn about clinical skills right from the very beginning, and all of our teaching is done in a case-based system.
You might be in the first week of medical school learning about the basics of the machinations of the cell, and at the same time going to a class right after that where you're doing role play exercises or taking an oral assessment. And that clinical component now goes through all 5 semesters, as opposed to sort of coming on later in the curriculum where it traditionally would have appeared.
We're constantly looking at how can we better help students to learn the information, and not just learn it in a rote or superficial manner, but to gain conceptual understanding so they can take what they've learned and practice it.
It's a small school. A small school enables you to individualize the journey of each and every student.
We really focus on a team approach. So students work in groups, they get to learn in groups. We try to create something that really completely supports them from the get-go.
We're training students to be competitive with the United States medical education system and the schools that turn out students here. So we're all competing for the same jobs.
Over and over we heard from program directors, your student, MUA students, are doing very well, both when they're coming here in interviews and after that in residency.
So at MUA, we really strive to make sure that our educational programs are at the forefront of medical education. We research, we do our homework, we make sure that our programs are in keeping with the most recent advances in some of the top schools in Canada and the US. And that has proven out. Our students have continued to increase their achievements.